You wouldn't believe how hard it is to work in healthcare right now. There are so many problems. We are understaffed. We don't have enough beds. We don't have enough supplies. And we have patients who just don't understand. As nurses, doctors, medical assistants, certified nursing assistants, home health aides, respiratory therapists, pharmacists, whoever you are in healthcare, you see a lot of things that make you want to quit. But there is one thing that really gets under my skin more than anything else. And it is when people think that healthcare workers have something better to do with our time than take care of them or their loved ones. It's not about being busy. It's about making choices. It's about prioritizing. It's about respect. When I was working as an RN, there were several patients who frustrated me. There was the lady who called me names and cursed at me because I was taking too long to complete my assessment. The truth was I had other patients whose conditions were more emergent who needed my attention first. But she was sitting there in the hallway waiting for me, so I could tell she was getting pretty impatient. When I finally got to her, I asked all of my questions and explained everything that I needed to. And then she started yelling at me because I was taking too long. She said, "What are you doing? You're wasting my time." I looked at the clock. I hadn't been in there for more than 20 minutes. But this lady was fuming. She continued to yell at me. And finally, I just stopped what I was doing and told her that if she couldn't behave appropriately, then I would leave and come back another time. She calmed down immediately and started answering all of my questions. I finished my assessment and I documented everything that she had said to me. And when the doctor came in, he knew exactly what happened. He talked to her about appropriate behavior, but nothing changed. The next day she did it again. And the next day after that, she did it again. That was my least favorite patient. Another type of patient who frustrated me was the one who thought that they knew better than the doctor or the nurse. They tell me that they didn't want the pain medication that the doctor ordered, or they refused to get the flu shot. They knew that they had the flu, but they didn't want the vaccine. I had patients who refused blood transfusions, IV antibiotics, chest tubes, dressing changes, wound vacs. Some of these patients ended up dying because they refused life-saving treatment, and some of them did end up getting the treatment, but not until they had suffered needlessly. This really bothered me because I had other patients who would listen to their doctors, trust the nurses, and they would follow the plan and they would end up doing well. So I couldn't understand why someone would want to improve their condition by taking antibiotics or getting a blood transfusion. Then I realized that it's not always about knowledge. Sometimes it's about fear. Some patients know the risks and benefits of treatment, but they choose to refuse it anyway. Other times, patients don't know where their fears are coming from, but they feel something deep down inside telling them that they don't want that treatment. In either case, it's not your place to convince them otherwise. Your job is to present the information, explain the risks and benefits, and let the patient decide. And if they refuse, then you document it. You let the doctor know. You give them the information they need, and then you move on. You can't force someone to accept treatment if they've made it clear that they do want it. But those patients aren't the ones who really frustrate me. They're the ones who think that they know better than the staff, but they won't even listen. I remember a patient who refused to stay in bed. He had a pressure ulcer that was draining heavily. We put him on a pressure ulcer prevention mattress to relieve the pressure off of his heels, but he kept getting up and walking around. Every time he stood up, he would soak through his bedding and he would walk around with a big pad of gauze taped to his heel. We asked him multiple times to stay in bed, but he refused. Then one day he stood up and fell. He broke his hip. His family was furious because he fell and they blamed us. I talked to his family and explained that we had told him multiple times to stay in bed, but they told me that they had also told him to stay in bed and he still was listening to them. They said that they would talk to him again, but once a patient has been admitted to the hospital, the patient is responsible for their own actions. If we tell them not to get out of bed and they fall, then we may be liable for that injury. So I told them that I was sorry, but we couldn't keep him in bed for them. All we could do was try to convince him to stay in bed, and if he wouldn't listen to us, then we couldn't stop him from getting up. They were upset, but there was nothing that we could do. He had to make his own decision. Those patients frustrate me, but I can deal with them because I understand that sometimes people are scared. Sometimes they don't know where their fears are coming from, but they feel like something isn't right. And sometimes people just don't listen very well. But there's one group of patients who frustrate me even more. These are the ones who expect you to drop everything else to attend to them, but they won't consider how it affects you or anyone else. There was a time when I was working as an RN and I was giving report to the night shift nurse. This was the end of my 12-hour shift, and the patient was being discharged, and we were going over discharge instructions, and she needed her pain medication adjusted. I tried to call the doctor 3 times while I was giving report, and he never called me back. Finally, I went into the room and told the patient that we needed to wait for the doctor to call me back before we could adjust her pain medication. She was frustrated because she wanted to go home and she didn't want to wait any longer. So I left the room and I went to my computer to finish charting. I finished charting and I went back to give report, and the patient was standing by the door, ready to leave. I told her that I needed the doctor to call me back, and she screamed at me. She yelled, "Do you think that I'm trying to get out of paying my bill? Do you think that I'm trying to leave without paying? I want to go home. I don't care what it takes, but I want to go home." I told her that I understood, but I needed the doctor to sign the discharge order, and he wouldn't sign it until I gave him report. At that point, she stormed out of the hospital. The admitting nurse called the police, and they actually came out and talked to her. Apparently, she had left the state, and they couldn't do anything about it. There was no way that I was going to call the police on her. I felt bad. I knew that she was in pain, and she wasn't taking her pain medication because she didn't want to become addicted. But I couldn't help her because the doctor wouldn't return my call. The next morning, I checked her chart, and it turns out that she went home, and she ended up in the emergency room within 24 hours. And that's the kind of patient that drives me crazy. Right now, hospitals are extremely busy. Staffing is short. Supplies are low. People are being turned away from their left and right. Hospitals are diverting ambulances. And if you show up to there, you may end up being transferred to another facility, or maybe you just won't get seen at all. I don't know where you live, but here in Minnesota, COVID cases are surging. The hospital I work at is diverting ambulances. We're turning people away from there. And at one point, we even had to bus patients out of our facility to other hospitals. And this is happening everywhere. There's a shortage of nurses. There's a shortage of physicians. There's a shortage of supplies. So when you come to the hospital, please be respectful. Be kind. Understand that we are doing the best that we can. Yes, you may have to wait a little bit longer to get your meds, but we will get to you. Please be respectful to the staff. We are doing our best. There's a time and a place for everything. If you want to yell and scream, go outside. Go to your car. Don't do it in front of other patients. Don't do it in front of other families. Be respectful. You wouldn't like it if someone was screaming and yelling at the person in the next room over. So why do it here? I know that you wouldn't. Why would you want to put other people through that? I know that a lot of people are scared right now. Healthcare workers are scared too. A lot of us are burned out. A lot of us have lost colleagues. We are grieving. We are angry. We are sad. But guess what? We still show up to work every day. We still do our best to take care of everyone in front of us. I'm not gonna lie to you. Sometimes it's hard. Sometimes I feel like I failed my patients. Sometimes I don't have enough time. Sometimes I don't have enough help. And sometimes I just don't know what to say. But I'm a healthcare worker. I am a caregiver. And that's what I do. I take care of people. That's why I show up every day. That's why I push through the charting, the phone calls, the pages, the constant interruptions, the rude comments, the disrespectful language. I do my best to take care of the patients in front of me, and that's what you should expect from me, and that's what I expect from myself.